quite often if an elderly person or even a young person has a fall, they're brought in by the paramedics, potentially with one of these A&E collars on, or sometimes some other kind of collar. They're admitted to the ward, and we've trained the nursing staff to put on a Miami J collar or equivalent, whatever's needed, whatever brand is most required, so that the patient, especially over the weekend, they're not in this quite uncomfortable hard collar. So obviously, if it's midweek, then we will see them fairly soon. But what will often happen is that there'll be a referral made to say they're in this collar, can we check it? The orthotists attend the ward and the patient is found to have dementia. And therefore, what do you need to do? So I suppose this is a case study where you need to determine, do they have capacity or not? And if they do, if they don't have capacity, what paperwork is available? And there may be necessary to discuss the risks of wearing or not wearing the collar versus wearing it, the level of fracture, spinal guidelines, alternative treatment options. Quite often you're met with a patient who's trying to pull the collar off, trying to grab it, has ripped it off, and the patient is obviously quite distressed. And so I think that's the key thing here, is to think about how you communicate when you go into the ward, you see the patient. It's important that you're confident enough to request involvement with the multidisciplinary team so that you can all make a decision on what's going to be the best individual course of action for the patient. There's no easy answer. It really is a case of individualizing the treatment going forward. But some of the things we've had to do is perhaps you know, the patient wears the collar when they're sitting up and then they take it off when they're lying down.